You even start off your lectures. You and I talked about this. You even start off your lectures. Even at the ADA, when you had 1,300 people in those 2 programs, you shook the hands of everybody who walked in the room.
Right. That's something that I started to do years ago. You who have done a lot of public speaking, you know how scary it can be to stand up in front of a room of strangers.
Now you don't have any strangers.
I try not to.
You got a sore hand.
I do. What I try to do is I try to meet the men and women that have put their confidence in me to spend a half a day, a full day in one of my seminars. It seems to me the least thing I can do is to greet them and say, thank you for choosing this seminar. I'll ask them, why did you pick this meeting? And usually they'll say, because it was free. I'm like, thank you very much. Or other times they'd heard about me, or they'd seen a video, they'd heard an audio tape. And it's amazing that once I start the seminar, I'll ask that question, how many of you did I get to meet? And most of the people will raise their hands, and I'll say, wasn't that kind of our new patient experience? Think about back in your practice Monday morning. Now what will you do differently when that new patient comes in? Is it going to be commodity care? Or are you going to offer them something different, a distinctive, a wow, when you actually do something like have the audacity to walk out and shake their hand and greet them?
You're speaking of that sometimes they've seen a videotape of you or heard you speak somewhere else, or the audio tape. You've got the audio tape out right now with Care Credit. That was kind of neat. I got a chance to listen to that. Dake and I were talking about that, riding in from the airport. Very nice. Nice job.
Thank you. I appreciate that.
That's fun. So I want to go back to that little card you said, because I like the idea of a system. I'm kind of a systems guy in the back of my mind. I don't want it to ever look like systems, and I'm sure you don't either. So it's not like you get the card out and walk around to the patient. Hi, Dr. Hyman, how are you today?
Exactly.
How's that molar that you broke on the upper left? How do you communicate that? Do you use that in the morning huddle? Do you get those cards out and you say, so-and-so's coming in, here's what we're doing? Is that an opportunity for communicating that?
Right, it's a classic opportunity. And again, in my seminars, I'll ask how many of you do a morning huddle, and a number of hands will go up. And I'll say, how many of you used to and quit? And it's staggering how many hands. And
how many do you see? How many
it's as many as are doing huddles still.
Really?
And I'll say, because why? Because you became old, because doctor wouldn't come in on time.
Didn't see a value in it.
Couldn't see the value, and that's where I try to walk back by using that new patient form, purging the charts. I mean, one of the things that irks me in dentistry is the number of watches we have on charts. What are we watching teeth do that are cracked? We're just watching them get worse because we're afraid to confront.
Here we don't watch infections on our hand, do we?
Yeah, it's not congruent with being a turned-on, passionate, fired-up team committed to helping patients keep their teeth. So in our morning meeting, in our morning huddle, the business team will present the new patients and who had referred them. So that's part of the standardization, is how long has it been since they've seen a dentist, who referred them, what's their chief concern, so that we make sure that we attack that right from the start. This kind of goes back to dental school, but I write down during my new patient experience, I'll put CC, chief concern.
Remember what it used to be? Chief complaint.
Exactly. Because that's not a good word.
That's right. So now it's chief concern.
But I'll ask that. Let me make sure I understand, Mark.
Why
the main reason you're here is what? Because I want to whiten my teeth. But then if I see you've broken a tooth, then whoops, it goes to endo, and then it gets crown lengthening, and then you do a crown. But we never whitened your teeth. I never got back to remembering why you first came in. What was your chief motivator, your chief buying concern, chief need?
Very good.
For teams that don't have a consultation, in our new office, we have 2 consultation rooms. That was important to me when we did the building, that I wanted to make sure we had ample room to sit down and have that relationship time with the patients.
And that's in a special room?
It's a special room, which is beautifully decorated. I had one patient say, you know what, this looks like an investment banker's room. This looks like an investment banker's office. And I said, you know what, you're about to make an investment in your health. A wonderful coincidence to report.
If you haven't left by now, you can afford it. That's right.
And most of them are very grateful. For folks that don't have that space in their office, I would counsel them to, once the patients are seated, don't have the napkin on, take off your white coat, don't stick those bite wing thingies in their mouth, sit down knee to knee, eye to eye with them, introduce yourself. I suspect when you saw your patients, you would introduce yourself as Mark instead of the doctor.
I did.
And it just personalizes and humanizes things. And
for me it was always easy because I worked with my wife. She worked as my chairside assistant. She's a dental hygienist, so she's worked in various capacities in the office, Denise. And then my mother-in-law was my office manager up until 2003. So I didn't get away with being doctor or anything to too many people. And in fact, I remember in the early days being in the office, and I'd say, I'd be very businesslike and serious. I'd grown my mustache so I looked older, wanted to lighten my hair rather than darken it like I do now. And I'd say to patients, yes, Mr. Hyman, I think that'll be great. Let me have you go up front and talk with Jan. She's my office manager, and she'll make those arrangements with you. And then I'd turn and go, hey, Mom.
I love it.
Mark will be coming up front, and the patient will go, Mom, oh, Jan's my mother-in-law. So we couldn't keep up those airs very long.
It's a great icebreaker, too, there.
I had to have the cards come down.
Anyway, the morning huddle, morning meeting, as we were saying, for teams that used to and then quit,
Yes.
I would challenge them for the next 30 days to make that commitment and to find the benefit. Roughly, many dentists work about 200 days a year.
Okay.
Have you heard that? Does that seem like a rough
somewhere between
4 days
180
a
and
week?
200? Sure.
If one turned-on, fired-up teammate found one piece of $100 inefficiency in that schedule, in your 8-hour schedule, that's a $20,000 change in your practice in 1 year without adding staff, without adding equipment. If each of your fired-up, turned-on teammates found one piece of $100 inefficiency in your schedule, the multiplier is just staggering. My further challenge is for our valued hygienists who we adore to look at the charts, purge the charts, look at all those back molar teeth that have those MODFL, TWA, KLM amalgams that have been in there since World War II. Take a camera shot of them, put it up on the monitor for the patient to see them, then you've really built value. The patients own their problems. If the teammates commit to do that for 30 days, if only once a week you add 1 crown by using that technology,
Yep, that's pretty good math right there.
added a modest increase to your practice. If once a day you add a crown, I mean, there's really not a practice, there's not a team that will listen to this tape that if they make that commitment for 30 days, couldn't change their practice $100,000.
Yeah, that's huge. Well, so what you're telling me is the second thing that I always like to hear. I like to hear about systems, and I like to hear about measurements of those systems and making sure they're effective.
Right.
Or effective. And you're actually telling me that there's a return on the investment.
I think there's,
if you take 10 or 15 minutes in the morning, huddle, put in place some of these things that you want to do and communicate the information and make sure you're all on the same page for that day.
right. You know, as we talk about money, it's not all about the money. We certainly need to be profitable or we're not in business.
Absolutely.
But how stressful is it for us as doctors and to our teammates when a patient comes in and didn't take their pre-med?
Mm-hmm.
Well, maybe if you looked in the chart and saw the last 2 visits, they didn't take their pre-med, you could make that extra phone call the night before, the morning of. Ask the patient to come in an hour early if you have to do that. There's a cancellation in the hygiene book. You've seen the statistic. If you just lose 1 hygiene appointment a day, every day for a year's time, again, it's that $20,000, $30,000 hit to the practice. Or if you purge the charts and see someone's coming from restorative and they missed their last 3-month recare, and you fill that in, there's just these little adjustments and tweaks to the practice that can have staggering impacts. First and foremost on the health of the patient. They get better
Good
care.
point.
They keep their teeth the rest of their life. They save money in the long run. The team runs smoother. You're more profitable. Everybody wins.
I like that first and foremost on the health of the patient, and then everything else falls into place after
Right.
that if you've created the systems the right way. Now, when you mentioned the magazines in your office, I mean, I have to be honest, when you started mentioning, and you mentioned Harvard Business Review.
Right.
And I responded quickly, that's one of my favorite magazines, and I love reading that. That one and Mitt Sloan, I like having a business mind to things.
Right.
But I probably wouldn't have thought to put that in my waiting room. And I'm not sure what I would have in my waiting room if I were designing it today, because I don't practice full time and I don't have those responsibilities. That falls on Eric's shoulders. But you said, how do you know what your patients want if you don't ask them? So have you asked them? Is that how you've got that information and figured out what kind of stuff they want to see and feel and touch in there?
That's a good question. I think by going to physicians and dental offices growing up and you saw magazines from that were years old.
Absolutely.
And
Nixon's
ripped.
still president.
Right.
Look at this. Yeah.
Who knew? I wanted, again, to create an ambiance of distinction and of something better.
Okay.
So we try to have a variety. You know, I've heard at seminars, don't have a magazine that competes with people spending money on dental care. And I'm not sure that I buy that.
I haven't heard that, but I can understand the thinking behind it.
Clearly,
Sure.
people are in a dental office. They're going to come to purchase some form of dentistry, some level of dentistry. So I appreciate that opportunity. And so we have Elle, Vanity Fair, Harvard Business Review, O, Oprah's magazine.
It's a great magazine, too.
And of course, my UNC alumni magazine, my Tar Heels, just have to throw that in.
Yeah, it's Tar Heel Dentist is your website.
Yes, it
Tar
is.
Heel, everybody's going to go there. Now,
Proud
Tar
of
Heels, they have a sports team there. They play basketball, do they?
Yes, that would be where Michael Jordan played basketball. Thank you very much.
I've heard that. That's true.
Heard of him?
You also mentioned, and I've heard you talk about this before, so I'd love you to expound on it. One of the things you do to communicate well with patients is you use the intraoral camera very well.
Right.
Say more.
Mark, intraoral camera is something I knew I didn't need in my practice because I bought my practice in 1986, was struggling badly, heard Linda Miles' seminar. My practice doubled and doubled and doubled. Things went bananas, and I was busy. I started going to Pankey in 1990, which was very liberating to me to stop doing single-tooth dentistry, to slow down, talk to the patients, get to know them, ask do they want to keep their teeth the rest of their life, and work towards optimal care when it's appropriate for patients.
Never saw a tooth walk into your office, just
Not
like
even,
Dr. Pankey
exactly.
used to say.
That was
Beautiful.
It's sagely words. It's still relevant today.
Indeed.
My Patterson rep kept pushing cameras for me, and I told him these exact words: I don't need a camera. I'm already busy. I'm already successful. And finally, I decided to buy. I'll tell you, as I think about it, one of the reasons that I got the camera first, I used to play a little bit of golf very poorly. And I saw a video of my swing, and that was frightening in and of itself. But then I said, you know what? This is how people learn, it's how they make buying decisions. So I got a camera in the office. I think 1991 was the first time. I bought 2 cameras, hooked them up that morning. I'm taking pictures of patients' noses and ears. I didn't quite get it. You're supposed to put it between the lips. I'm not very good with my hands, but I mean well. Finally, I checked 4 hygiene patients that afternoon with the camera. These are patients that had been in my practice for 5 years. For 5 years, I'd been saying, you need a crown, you need work, you need this done. And with them saying to me, you must need a new car. Why did my last dentist tell me that? Let me think about it.
Which kid's starting college
Let me
now?
ask my cousin's milkman's uncle. Let me think about it. Let's call Aetna and get a pre-denial.
Pre-denial, I like that.
And and it's humiliating. We spend all this time in school, and then you get patients saying, let me think about it, which is a polite way of them saying no. I hooked up the camera that morning. I checked 4 hygiene patients. That afternoon, we scheduled 8 crowns.
On 4 patients?
On those 4 patients.
Interesting.
And at the end of the day, I sat back and said, I just paid for that camera. And it was staggering to me. Now in our new facility, we have 8 operatories. We have 8 intraoral cameras.
No kidding.
We bought 8 digital dock cameras. We have them built into the console. We have the European Continental units.
Okay, sure.
And the cameras are built in right next to the handpiece so that we can pick it up and go live at any time. And I've heard people say at seminars, you know, a digital camera is all you need. And I passionately believe that digital photography is critical to dentistry.
I know you do some beautiful photography.
But are people taking off their gloves for that or not? How does that interrupt the flow of patient care? So the beauty of an intraoral camera that you can contaminate.
It's now.
It's now. And for all of our patients, as we mentioned, our friends in the insurance industry, thrilled our patients have the benefit of dental insurance.
Sure.
We take an intraoral camera shot before, during, after. And we print out a color photo to go with every insurance claim. So we don't do pre-authorization, pre-denials from our insurance friends. When patients ask, the intraoral cameras is an automatic second opinion, and you're automatically credible. So you almost want to say to patients, don't believe me, just look at this.
And there is something very powerful about the visual image up there on a 23 or 25-inch monitor in the corner of the room.
It's just a staggering impact on our patients. I've heard people say, well, that takes patients away from optimal care and it changes them to single-tooth dentistry, and I don't believe that. I think what it does is it takes them from completely unaware to dramatically aware. Dr. Kathy Jameson said 8 words that rocked my world. She said, how do you create the sense of urgency? How do you create the sense of urgency for the patients to act and see that you have something important to say? And again, the Dale Carnegie organization says 3 words, evidence defeats doubt.
There you
Mark,
go.
I see you as your dentist. I say, I see a broken body part. You say, prove it. We put up a color photo. And what I try to say to our friends in dentistry is that in a business negotiation, the first one to speak
loses.
loses.